Welcome to Marketing and Mindset for Wellness Coaches, the podcast for health coaches and wellness entrepreneurs just like you who are building a business, making the world a healthier place, and designing a first-class life. I'm your host, Kim Foster, MD and certified business coach, and I'm on a mission to help you up-level your strategy and raise your mindset so you can truly thrive and grow your business. Let's get started. Welcome to today's episode. I have got a great episode for you today. You are going to get to listen in to my chat with a very special guest, Dr. Michael Goldberg, who is a dentist and an entrepreneur based in New York City. So early on in his professional career, Michael built a prestigious group practice in Manhattan where he focused on comprehensive whole body care. This practice was one of the premier whole health focused cosmetic and restorative dental practices in the world. Now, I've known Michael for a little while, and what I know is that he has always been ahead of the curve and on the forefront of dentistry's innovation and integration into whole health focused practice. More recently, he's turned his expertise toward dental sleep medicine and TMJ or temporomandibular joint disorders. And he is now also the author of several books and publications and continues to educate the public as well as dentists nationally and internationally through speaking and events and all kinds of interesting ventures. In our chat today, Michael and I get into some interesting topics, that's for sure. We talk about what we see to be some of the major limitations and shortcomings of our current healthcare systems. And Michael shares with me what changes he would love to see in how we all approach wellness, and also about all of the incredible opportunities that he sees coming out of this disastrous past year with the pandemic. We also talk about the untapped opportunities for collaboration between the medical, dental, and wellness worlds, and some of the ways that we can begin to work together to elevate everything and work toward a better way forward in health and wellness. It's a really great conversation. I loved talking with Michael, and I think you're going to really enjoy listening in. Okay, so hi, Michael. I am so excited to have you here today. Thank you so much for being willing to join me and talk with me about all of the amazing work that you do.
Well, thanks. I hope we get to talk about all the amazing work that you do.
Well, we will see where the conversation leads for sure. But yeah, I mean, there's a lot of things that I'm hoping to ask you and learn about from you. So let's just dive in. I mean, for starters, I would love for you to tell us a bit about your story. You know, for listeners who are new to you, give us a bit of background about you and what brought you to this point, you know, in terms of the work that you're doing now.
Great. So it's a long story because it started, I guess, upon my entry to dental school, and that was back in 1973. So it's been a long road. So we'll take we won't take too many detours, but suffice to say that I suffer from a professional case of attention deficit disorder. So I have a theory that, you know, we go to high school for 4 years, we go to college for 4 years, we go to professional school for medical and dental school for 4 years, and we get into this 4-year cycle. And then all of a sudden you get out into practice and 4 years go by, and 5 years go by, and 6 years go by, and you're like, okay, what's next? So I've always been very proactive and paranoid about not knowing what's next. So I've always invented what's next. So it was private practice and it was academics. At first it was volunteer academics. And then I built a practice, and then I sold the practice, and then I went into full-time academics. I ran a hospital dental residency program. I taught practice management. I taught various courses at the dental school. And then I left full-time practice and I opened yet another multi-specialty group dental practice. And it's been a lot of fun. And I guess it's about 3 years ago, I started a company called Practice Perfect Systems, which was built because I started seeing issues in the dental field relative to doctors not being able to accomplish what they set out to accomplish from various standpoints, both clinically and financially. So since then, and since when COVID shut us down, I decided to take a sabbatical, and I've been focusing on the coaching and consulting part of Practice Perfect Systems, and it's been fun. Oh, and along the way, I've written 4 books.
Four books.
Oh, yeah. So, yeah, the first book was entitled What the Tooth Fairy Didn't Tell You. And it was in response to a patient who had come in and was, it's an interesting story. So, and I tell it in the book. So she came in and she said, she was a very intelligent woman. She was a librarian. And I guess for younger people, a librarian is somebody who worked in a library. And they don't have many of those anymore, at least not the way we remembered them. Anyway, she had been told she needed a lot of work, even though she had been going to the dentist. And she came in and told me that she had been referred to me nearly 30 years prior by her best friend, who was still a patient of mine. But her best friend said to her, "He's really good, but he's very expensive." So she decided to go to her union dentist. And she went to the union dentist religiously. She did everything she was told to do. And when she came to see me, I had to tell her that, and this is back in 2009 or so, I had to tell her that it was going to take almost $60,000 to get her mouth into good shape. And she sat there in the chair and she cried. And of course, I felt terrible. I almost cried. And she looked at me and she said, "I just retired and I didn't plan for this." And the upshot was, I mean, she was great. She's still a patient of mine. Her mouth is great. We found some creative ways to make it work for her, financially and otherwise. And that was the impetus for me to write this book. I said, you know what? I need to get the information out there. So unfortunately, it was 10 years ago, and I probably need to update the book, but I've been so busy doing a whole bunch of other things, I haven't gotten around to that yet. But it's still on Amazon. It's What the Tooth Fairy Didn't Tell You. And it's still a great book.
Yeah, it sounds great. I mean, I do love the title, and that's a powerful story for sure. And so I guess, I mean, this sort of brings us to the issue of prevention and getting ahead of things rather than just being reactive and then facing an expensive bill and, all of those kinds of things. And I know we've talked before about the issues of prevention, and, I would love to hear your thoughts. I know you have some thoughts about the way that our healthcare, like our current healthcare systems, are set up. Like what we both refer to it as a sick care system, like a reactive system. I'd love to dive into that a bit. What are the biggest problems that you see today?
So what's really interesting is that dentistry has really focused on prevention. Mm-hmm. So, and almost it's an actual accident. So most people know they should brush their teeth twice a day and go to the dentist twice a year. And so most people have bought into that, and they go to their dentist more frequently than they go to their physician. And you go to your dentist usually actually when you don't have problems. So, do you know how that happened?
No.
It was a Pepsodent commercial in 1928.
What?
Yep, a Pepsodent commercial. They're selling toothpaste, and the ad said, brush your teeth twice a day and see your dentist twice a year. That
Really? That was the beginning of that's where that
there
came
is
from?
no evidence-based data to support that.
Wow.
None. Madison Avenue created preventive dentistry.
Wow.
And it's worked. It has
Sure.
worked. When I was in dental school in the 70s, we were taught that the average American at age 65, the average American had dentures. I don't know exactly what the number is, but dentists around here in the Northeast make very, very few dentures. People are keeping their teeth. So we're used to prevention. So when I look at healthcare and I see the fact that people don't go to preventive medical visits, I'm like, why do they do it for the dentist and they don't do it for the physician? It just doesn't make any sense.
Question. Yeah, it's a good question.
And some of it is insurance driven. Whether it's Madison Avenue or insurance, it's the cart pulling the horse instead of the other way around, right? So what we know is if preventive dentistry can work, well, why can't preventive medicine? And unfortunately, nobody's dangling the right carrot in front of people to say, hey, listen, you need to see your doctor to discuss how you can prevent getting sick, rather than only visiting your doctor once you are, because then you're treating the symptom and not the cause. And I was always about looking at what the cause of the problem was so that the symptoms won't either develop, or if they did develop, we can fix it so that they won't develop again.
Mm-hmm. Absolutely. I mean, 100%. So the challenge is like there's a lot of challenges. I guess maybe for starters, we need like a Pepsodent equivalent.
Yeah. So who's gonna fund that? I mean, our insurance company is going to fund that? No. What's interesting is, and they should, because it would actually save money. I mean, if you can prevent people from having to use the emergency room in a hospital, which is by far and away, as you know, the most expensive care in the world, it'll save you billions of dollars a year nationally.
Oh my God. It would be huge.
But it doesn't seem that anybody's really incentivized. There was a company called Flying Tigers. Flying Tigers was started by some ex-World War II airplane pilots. And it was one of the first FedEx type delivery systems. And I think they were actually bought out by one of the big companies, DHL or FedEx. But anyway, this patient of mine was in that company, Flying Tigers, and they had a dental insurance policy that said, if you go to the dentist twice a year, we will cover everything that you need at 100%. If you do not, we will only cover it at 70%. Yeah.
Interesting.
Incentivizing people to do the right thing. But that's not the system that we have.
No, it's definitely not. Okay, well, I mean, tell me, do you have some ideas? I imagine that you do, of ways that we could actually, start to create this paradigm shift so that we are coming at things from a different direction. What do you think?
Well, so I think we can talk big and limitless possibilities that would take lots of work and coordination, which is challenging. We can talk sort of micro and talk about, sort of communities of people. And I think that that's where you start making the difference. And you start making the difference with local networks that can be educated as to how they can prevent problems from occurring. And that's why I love what you're doing, because a health coach does just that. They are coaching people to be healthy rather than treating people when they're sick. And that has been the missing ingredient. So unless we're going to rely on government, or we're going to rely on insurance companies or large corporations to do something like this, it's going to be up to small little networks. And that's, I think, where you're going to wind up seeing how these things work. And once you get enough of that going, it's going to catch the eye of people. And I think that's when you're going to start seeing it sort of cross the chasm and become a little bit more mainstream. When you can, somebody has, 20 or so patients that they're coaching, and these people are staying well and spending less money on their healthcare, that's going to eventually start getting noticed. So I think what you're doing is you're starting a micro movement, and eventually, if enough people do this, then it's going to wind up changing the big system.
Right. Like a grassroots, really, like starting local with actual real people and creating real results and change on an individual level, which then filters out and up and bigger into creating that paradigm shift.
Yeah. Absolutely. And I think that, people are so frustrated. And I think, I'm an eternal optimist, and I'm always looking for the silver lining. And I think one of the potential silver linings of this COVID epidemic has been people now understand the value of preventing things from happening. So we understand that this virus has preferentially attacked people that have underlying diseases and immune issues. And it becomes more important than ever to make sure that you're keeping yourself healthy. So I think it's a great opportunity now to get that grassroots effort underway. And it becomes even easier because so many of us have gotten used to doing things via technology that just facilitates the process.
Oh yeah, absolutely. Yeah, I totally agree. There is a lot of new opportunity that this crisis has opened up for sure. So, I would love to dig a little bit more into the intersection between, the world that you have, inhabited for so long, like the dental world and the health and wellness world. Like, tell me a little bit more about what your vision is, or how you think of, health and wellness and connection with dental and the dentistry world. I'd love to dig into that a bit.
Yeah. So I was a founding member of an organization called the American Academy for Oral Systemic Health. So about, I guess, 10 years ago, there started coming into the literature a lot of data pointing to how things that were going on in the mouth were impacting the rest of the body. And that's become an avalanche of data now. I use Google to sort of tell me when certain things are coming into the healthcare scene. Mm-hmm. So I'm always getting, notices about things like oral microbiome and inflammation and sleep and the gut microbiome neuropathways interaction. So it's interesting. It actually coincided with my father getting Alzheimer's disease. So I'm reading a book called, and I forgot the author's name, The End of Alzheimer's. Bredenson. I think Bredenson was the author. And he's talking about how specific pathogens are found in the brains of people who died of Alzheimer's disease. And they're pathogens that are found in the mouth.
Mm.
And I'm saying, I need to get into this a little bit more. So I was a founding member of this organization, and we had I think it was our third annual meeting was at the Cleveland Clinic. And Mike Roizen got up and gave the keynote speech, and he was the chief wellness officer of the Cleveland Clinic. And he said that the key to health was, how did he put it? It was floss, wine, and sex.
Mm.
Well, floss because it helps prevent the gums from being inflamed, and inflammation is a big driver of immune problems. Wine because resveratrol is an anti-inflammatory, and sex because of all the great hormones and endorphins that it promotes, which also impacts your immune system. Now, that was quite a while ago, and since then, I am sure he would add sleep to the mix. And that's why it was 9 years ago or so, I went back to Tufts Dental School, my alma mater, and I took a mini residency in dental sleep medicine. Because all of a sudden, I realized that not only can I help fight gum disease by doing things that most dentists do, but I could actually make appliances that people could wear at night that would help prevent sleep apnea in those people who couldn't tolerate CPAPs, which are those big clunky things that fit over your face.
Mm-hmm.
So I got into dental sleep medicine. So it's been fun seeing how what I thought I was doing, which was caring for people's mouths, how that actually had a significant impact on their overall health and wellness.
Yeah, so, absolutely.
Right. Dentistry is very intimately related to the microbiome. It's related to how you're able to ingest and then digest what you eat, and how you breathe, and then hence how you sleep. So really important. But the idea is that, I wasn't treating a mouth. I was treating a human being.
Yeah, absolutely. Right. So, I mean, of course, so there's a ton of connection, of course, then, although what's your sense? Like, do you think that most people are recognizing that connection, are aware of that connection? What's your take?
So I think people are recognizing the connection. I think there's still a little cognitive dissonance because though they recognize it, they don't necessarily act upon it. It hasn't become part of our routine. So I don't think most dentists talk to their patients like I did about how the bacteria that are in their mouth could possibly affect what's going on in the rest of their body. And I know that because there are actually companies that will allow you to test saliva to determine what those bacteria are. And I've worked with one of those companies. I think there are actually only two companies. And I work with one of them, and they're growing slowly, but they're not growing nearly as rapidly as they should. I mean, if you could spit into a tube, send it off to the laboratory, and find out that you have these bacteria that could increase your likelihood of heart disease, arthritis, diabetes, Alzheimer's, cancers, and a whole host of other autoimmune diseases, would you not want to know?
Yeah, of course. Absolutely.
But insurance companies don't pay for it.
Yeah.
And we've trained this is very interesting. So just like Madison Avenue has trained people to go to the dentist twice a year and brush your teeth twice a day, insurance companies have trained people to only do what the insurance is going to pay for.
Right.
If the insurance isn't going to pay for it, I really don't need it. Well,
Yeah,
nothing could be further from the truth.
of course. Yeah.
But that's how the insurance companies, and with the help of the medical and dental professions, have been complicit in that.
Oh yeah, exactly. Well, of course. I mean, this is opening up a whole other can of worms of like, yeah, the gatekeepers. Oh my goodness. But it feels like there's a lot of untapped potential in terms of what could actually be done to help, like, what people can do, because I'm so all about, and I know you are too, about people being empowered to do things proactively to improve their health and well-being, not just taking kind of a passive approach, or just like, thinking that there's nothing that they can do. But this feels like it's something that people can do, which is amazing. I love that.
Yeah. I mean, I think it was Zig Ziglar who said, if you don't pay the price for good health now, you will almost certainly pay an even greater price for poor health later.
Exactly. Exactly. Yes.
The problem
So
is that it's hard to get to change people's momentum.
mhm.
And education only goes so far. And I think it's up to people like you and I to figure out a better way of dangling that carrot in front of people and saying, this is something you need to pay attention to, because the outcome could be something you really don't enjoy.
Mhm. Yeah.
So we call that uncovering the person's why. So, what is important in a person's life? It could be being around to see their kids get married. It could be seeing their grandkids or seeing their grandkids get married. It could be, going on that trip and being able to be mobile so that you can do crazy things that you really want to do. Every individual has something that they really want to point towards. And what we haven't been able to do really successfully is, on an individual basis, uncover those goals so that we can then tie good health and wellness into those goals. And unless you have the time to do that, and unfortunately, most physicians do not have the time with the current business model, then people aren't going to be incentivized to do the right things.
Mhm.
So we know how many people don't take the medications that they're supposed to be taking, even though
Yeah.
it's prescribed, and they need to take it so they can prevent, atherosclerosis or, diabetic, shock. People don't take their medicines, and we know that.
Oh yeah. Well, of course. The gulf between knowing what you are supposed to do, and often even what you want to do, but what you actually do, like that gap between those things is huge, right? But that's where that coaching piece lives. Like that's why I'm passionate about that, the role of coaching, because it's exactly positioned to serve that and to narrow that gap. And like you said, tapping into people's why, like their deeper motivation. That's all coaching methodology for sure. And so, of course, many of my listeners, most of them really are health and wellness coaches. They're either building a career in coaching or they are coaches. So let's say for a listener who's listening to this conversation, they're intrigued by this connection between dental health and wellness. And maybe it's an area that they haven't really kind of considered before, and they're wondering how to incorporate some of those principles into their work with clients. What would you suggest? Like, where would somebody start with that?
Well, I think the first thing you do is I would start with your own dentist. I
Mm.
would contact your own dentist and see what his or her philosophy about that is. And from a wellness coach's perspective, that could open up an entire network of potential clients that would benefit from their services.
Yeah. Yes, I like that. I love the sound of that.
I know you would. So, so the nice thing about people who are going to the dentist twice a year is
Mhm.
that they've become acclimated to the idea of preventive maintenance. So these are people who know they have to come twice a year, otherwise they're going to have problems. So it's not that large a jump to go from that to, okay, let's talk about some other areas where you can prevent problems, not just a toothache, but what about maybe preventing that family history of diabetes from rearing its ugly head? What about the arthritis that you have? And maybe we can figure out a way of dealing with that. Now, the carrot that you can dangle to in front of the dentist is, well, we know that there's some oral systemic, some mouth body relationship, and we can get these people more interested in taking care of their mouth better too. So it works both ways.
Mm-hmm. Yeah, absolutely. It's definitely a win-win all around. Now, I'm also curious, like what you would say to somebody, somebody who's listening to this, maybe a dentist or a dental hygienist, like somebody who actually does feel really passionate about whole person wellness, not just limited to oral health. But so what is their next step? Like, what should they do?
So for a dentist, it's a little challenging because of the time constraints that are often put on them by insurance companies. I mean, look, it's a business. And if there's no money, there's no mission. So you have to make money. And in order to do it in an insurance model, now I was very fortunate. My practice was entirely fee for service. I didn't deal with insurance, but that's getting increasingly difficult to do. And in order to make money in a business that's controlled by insurance, you have to see a lot of patients, and you don't have the time to spend. But that doesn't mean no one in the practice can spend the time. So there are auxiliaries, there are hygienists. You can make a collaborative effort with a wellness coach to promote the fact that taking care of your mouth is just another part of taking care of your overall health, and one has a synergistic effect on the other. So I think there's opportunity for collaboration, and I think that's the future of wellness coaching. It's definitely collaborative, and as many people as you can get to buy into that collaborative network, the better it's going to be for the patient. So whether or not it's a massage therapist, or it's an acupuncturist, or it's a physical therapist, or it's a dentist or a hygienist, getting all those people together and discussing how what they do can help individuals is great. And we don't have quarterbacks anymore in our healthcare system. We don't have somebody who's guiding people about their nutrition, about their exercise, about their sleep habits. Somebody needs to sort of take the bulls by the horn and say, "Hey, I'm gonna help guide you through all of this." And I think really that could be the most beneficial function of a health and wellness coach.
Yeah, I absolutely agree. I mean, yes, 100% to that. Yeah. And I mean, I think this is exciting because really there is so much opportunity for collaboration, and, there are just so many different ways that this could go in the right direction with the right people. And, so it's very exciting. I love talking about all of this stuff.
And it's finding the right people to work with. I used to get angry. I would look at a person who came in, and I would go through their medical history, and I would start connecting the dots for certain things that were way beyond my scope of practice. And I got angry. I was like, what? I'm a dentist. Why am I the one that connected this person's diabetes to their gum disease? why was that me? Why'd the person who diagnosed their diabetes not talk about, hey, let's try to figure out where this is coming from?
Right.
And I wound up having to hunt out physicians who would get it. And I was working, I got most of my referrals from other physicians. And I worked with physicians who got it. And, they would ask their patients, at minimum, when was the last time you went to the dentist?
That's awesome.
Most physicians don't ask their patients that.
No, they don't. Well, this is the thing, like health has become so siloed. Like everybody's just in their corner working on their little tiny piece of the overall picture. And like you said, nobody's quarterbacking it. Nobody is like viewing the whole picture, which is, of course, you can see how there's so many opportunities then for things to go awry, like when that's the case. So I think it's high time for sure for people to come back together and for there to be much more collaboration and cross pollination. So, yeah.
Yeah. And, it's interesting. There was a company that was formed recently, not a couple of years ago, actually, by Warren Buffett, Jeff Bezos, and Jamie Dimon. Jamie Dimon's the CEO of JP Morgan Chase, Bezos from Amazon, and Buffett from Berkshire Hathaway. Three of us, arguably some of the wealthiest, smartest men on the planet. They formed a health company called Haven to try and change healthcare, at least in their small, sphere of influence. Not such a small sphere of influence. You're talking about probably hundreds of thousands of people. And about 2 months ago, they closed it up. It failed. So three of the richest, smartest people on the planet tried to fix the problem and couldn't. That was very demoralizing to me.
Yes, that is rather depressing.
Yeah. It just goes to show, though, that I don't think you can change it in big networks. I think you need to change it, like we said, from the grassroots. And when you start seeing little networks of blue zones, the book Blue Zones, those are, areas of the world where people just live longer. When you start seeing little pockets of those things, it'll start getting noticed. At least that's the hope.
Yeah, I mean, that's exactly what I was going to say when you were talking about the failure of Haven, is that, yeah, I mean, maybe that's just exactly what we were saying. It's not going to be like a big, enormous, expensive conglomerate or anything like that that's going to make the change. It's going to be on just that micro grassroots level. So that's encouraging. And that's definitely a hopeful, positive message for, the listeners who are, for the most part, like I said, independent health and wellness coaches who are trying to make a difference for their clients. So yeah, I love that message. So yeah, I mean, we are just about out of time, but this has been so amazing, such a great conversation. And I really appreciate you taking the time to chat with me and share with me all your thoughts and super valuable information. But before we go, would you tell our listeners where they can go to learn more about you and your work?
So the best place is Practice Perfect Systems with an S.com.
Okay, awesome. I will link that in the show notes for sure.
They can see what we do and they can contact me, and you can ask for a complimentary consultation. I'm happy to talk about this to anybody. And, Kim, I love what you do. I think that, if we can get people help promote health and wellness as opposed to treating the symptoms and the sickness, we'll spend less money. We'll be healthier and happier. And that's my mission. Healthy, happy people.
I love it. That's perfect. Okay, amazing. Thank you so much, Michael. Have an amazing rest of your day. I'll talk to you later.
Thank you, Kim.
I really hope you enjoyed listening into that conversation today, and I hope it got your juices flowing in terms of the opportunities that are all around us. And I hope that you're feeling inspired about the ways that you might expand your own view of health and wellness, and perhaps some of the ways that you might view the intersection of medical and dental care from a preventive health and a whole body perspective. So interesting. And like I said, I'll link Michael's info in the show notes for this episode so you can go ahead and learn more about him and his work. All right, that is all I've got for you today. I hope you have a fantastic day, and I will talk to you again next week. Bye for now. Thanks so much for listening. If you are ready to build a coaching business that gives you freedom and flexibility and allows you to make a meaningful impact in the world, but you're not really sure how to get started or what you need to do to attract the perfect clients and grow your income, then let me be your coach. I would love to teach you my exact framework, my proven method for how I created a freedom-based business for myself and how I've helped dozens of clients do the same thing and create a life that is better than their dreams. Get started by heading over to drkimfoster.com/business training, and there you can sign up for my free online training called The 4-Part Formula for Replacing Your 9-to-5 Income with a Coaching Business You Love.